you. All right, so I look at the next items here. Let's do that. So everyone's here. Okay. David is okay?
Ready on WebEx.
Oh, thank you. Thank you. Okay, welcome back. So I just want to summary early. We did the discussion on the doctor degree and the doctor titles in a certain length and a level. So this is just the board, on the side is a discussion, but it's a really rely on the professionals to take over to the next step. Okay, so board want to work with everyone. You can see it's a great discussion, but we are not here to tell the professionals what to do. All right, so we will work with you. And Mr. Boudia, anything else you want to add? No? Okay. Thank you. Thank you, everyone, for working hard on this. We tried to solve the issue for 50 years, so actually I'm happy. Now the next C and D, the prerequisite and science requirements. I thought that there's, sure, it's a little bit different, but it's all involved with requirement. There's a prerequisite, is more like an entry level, and then there is a part about the science requirement. Is it okay if we just lump it together to discuss, or should we open? Yeah. Okay, so I would like to do the similar, open up to the public, because I really want to, the professions, the schools, everyone to jump in, and it's your job to help the board, get, we heard early there are some professions and stakeholder mention about it, but we like to hear more from you. Thank you.
Just before we proceed with public comments on this or public contributions, I want to turn to the materials for this agenda item. On the first page, you will find the Business Professions Code pertaining to these requirements or prerequisites, as well as the California Code of Regulations below them. If we can scroll to page 1 of the Law and Regulations Education Prerequisite, once staff gets a moment there, I'll go ahead and read it. This is BPC, Business and Profession Codes 4938. The board shall issue a license to practice acupuncture to any person who makes an application and meets the following requirements: is at least 18 years of age, is really the major prerequisite that we have. Now, of course, this individual has to apply for a qualified educational program as well. Below that, we have the California Code of Regulations addressing the requirements of the tutorial program, and then again of the acupuncture and training programs. Now, one thing to note about the 1399.435, that last requirement on page 1, is that this was removed when the board lost its authority to do the acupuncture school approvals, and the board fell back to using ACOM standards. So I believe ACOM currently has the 60-unit minimum semester credits, and I believe it's 90 semester credits for the first professional doctor. Thank you. And for Chairman Techies, I open it up to public comment.
Thank you, Mr. Boudia. So for the schools, the prerequisite the requirement is a 60 semester credits and a 90 quarter credit or 90. But over here for the tutorial, there's high school.
Must have completed high school.
Must have completed high school. So there's no such 60 units credit.
Correct. Although in the tutorial program, there are at least 550 hours of courses that must be taken at a community college level, post-secondary education or higher.
This is for tutorial.
Correct.
So would it be equal?
I'm not quite sure that there would be equivalency there. We would have to look into that further. There are 798 additional hours in the tutorial program for the minimum requirement compared to the training program requirement. So training program's at 3,000 minimum hours. I'm not sure that we have any program that's just at 3,000. It's usually a little bit more, if not higher. We have 3,500, 3,450, 3,350, 3,600, 3,700, as far as I can recall, for our training programs.
Thank you.
Including the first professional doctorate. And some programs that have both have the same number of hours for both as well.
Thank you. Thank you. Public, anyone?
Neil Miller from Cal Atma. When we made the transition from 2250 or 2400 to 3000 hours, we went through 2 years of discussing this. One was discussing hours for a whole year. And the hours were between 3,800 and 4,200. And then somebody, doesn't matter who, said, hours isn't important. It's curriculum competence. So we spent a whole nother year going through everything, and we had to come up with what was the curriculum competent level that we needed. It was the same number, between 38 and 4,200. And then we had to move that into a legislative picture. And so we went from 3842 down to 28, as the national wanted to go from a master's to a doctorate, and it played into our story here. So our 3,000 hours was not based on 2 years of research that this board did in committee. So like 6 meetings, and it's part of the record, and I have it if you can't find it. It was based on a political decision. So in order to really protect the public, you should really understand that our profession over 20 years ago, our profession, meaning half of the representatives were schools and half of them were associations, said it was 38 to 4,200 hours. So we're talking about 3,000. So now I'll bring it up to today. So we're talking about what do we need for prerequisites and science requirements. I'm not so much the academic person, so I just want to share something that might make sense to you. Being in practice for a long time, you see what everybody's doing, where they're going to educate themselves. Are they taking CE classes because they need 25 hours and it's just some random class, or, but the people who are really getting focused, whether it's in reproductive health or in orthopedics, you look at what they're missing. I mean, they're going into specialization, but you realize in orthopedics, they're missing a lot of the basic things that you need to know. And we should have gotten this in school. So there are hundreds of people. There's about 5 or 6 different providers who are bringing us up to speed in orthopedics on stuff that they should have known. And the discussions on social media are, why didn't I learn this in school? I just got my doctorate and I didn't know any of this. I've been, and you keep hearing the stories over and over and over. And so these classes are, the fee is in the thousands of dollars. And it could have been, or it should be done at the entry level. So there's a whole bunch of, and I couldn't tell you what it is, other than to compare what we have now to what the results were of the board's study. So I'll try to find that if you can't, so we can make an accurate comparison of what do we have now and what did the professions say that we really needed that we haven't added in 20 years that we should really take a look at. And that might answer Dr. Mitaki's question in a very organized, succinct manner that will make sense to you. Like, this is what you got. This is what you said you needed. These are the courses that people are taking to get there. So that's kind of what you need in the middle. You have the basic science, but you need a little bit more. And you need to know how to communicate with other healthcare providers a little bit better. That's my experience, and that's what I'm seeing from the profession. This is what people who are in practice talking. And especially shocked me when people get out of the doctoral program and go, I just got out of the doctoral program, and I didn't learn any of this in school or in the doctoral program. So.
Thank you. Anyone else? No? Don't let us work on ourselves. We don't know how you guys practice. You? No? Yeah. Please. We want to hear.
So the doctoral program should be providing us with that specialty. And if it's not, then we should be hearing about it too, both at the California Acupuncture Board level and at ACOM's level. So the completion doctorate is supposed to provide us with the language to speak in an integrative medicine format. That's exactly what those extra hours are designed to do. The coursework is meant to work on case report writing, on intro to research, on helping practitioners develop the language needed to work in institutional medicine, like with where Dr. Mateki is. The DAOM is supposed to provide the specialty. USN University provides a specialty in reproductive medicine, and in some cases we do have to start from very basic gynecology, anatomy, physiology, but then they work all the way through reproductive endocrinology and genetics. Our second program is in integrative medicine, and that's a systems-based medicine where we go through each organ system and again start with very basic anatomy, physiology, but get them, all the way through to cutting-edge technologies. So that's what the program should be doing. And I don't know, again, I come back to the idea of I'm all for school. Clearly, I have a bachelor's, master's, doctorate, and I'm getting a PhD. So I'm all for education. But I do worry, when I hear and see on social media when students are complaining about the cost of school, the amount of time it takes to get through school, and again, thinking about gainful employment reporting, I do get concerned, with increasing the hours and increasing the cost. And there is a very strong movement nationally to come up with faster, cheaper programs. Pogatech has their acupuncture, community-based acupuncture program that's very affordable and very fast. And there is a strong movement to providing more access to programs like that. So not an answer, just, more background material. Thank you.
Thank you. Anyone else? No? So, David, let's open up to the WebEx.
All right, WebEx is open for public comment. It's time to raise your hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand. And for our mobile device users, you may need to hit the ellipses button. That's the ... Our first comment is coming from Lin Yang. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Hello, Lin Yang here on behalf of AACMA. I do like to point it out that we need to raise the education level for enrollment of the acupuncture program. In a normal case, students who enrolled a master's program are required to have the bachelor's degree. And then for students enrolling doctoral program, they're required to have a master's degree. This is a normal practice. So the acupuncture requirement right now, it's associate degree, so which is 2 years of college, or 60 credits, and it's I believe it's the lowest standard for a master's program. And if we are going to do entry-level program, needs to be raised to at least 90. And why I want to use the 90? I look at the doctor of chiropractor, the chiropractic education. So they have the lowest, and their lowest requirement is 90 credits. And the doctor of physical therapist, they require 120 credits, which is 4 years of college training. So again, we are at the bottom right now, and it doesn't reflect the effect and it doesn't reflect the good we can do for the public, and it doesn't bring the respect for our profession either. So we support to raise the educational level from 60 to 90 credits at least, and ideally 120. But I do share the concern. I do understand the concern from the schools about it could negatively impact enrollment. And my suggestion will be that we can enroll the students conditionally with the 30 with the 60 credits. And once they meet the requirement of 90 credits, and they can fully enroll the program. So I know that I know for the international students, if let's say that they have to pass the TOEFL exam in order to enroll the program in US. But if they are before they pass that, they reach the requirement of TOEFL exam, they can enroll a school and to study 1 year of English. And then once they read the requirement, they can officially or fully enroll the program. So maybe that's the approach that we could adopt, and to kind of ease the negative impact of the elevated education requirement. Thank you so much.
Thank you. Next, we're going to hear from Virginia. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Hi, I think that increasing the standards would be a great idea, and even better if it's actually a bachelor's degree, and that, yes, it makes it a little bit more scarce in the profession, meaning that there would be some people who decide not to go into the acupuncture program because they don't fit those requirements. I do believe that with that, though, even though the schools might suffer a little bit financially, I do think overall the profession would be raised and elevated in its status, and that the schools would be much more happy with the student retention rate, because if they finish college and stuck it out, they probably will stick it out through the entirety of the program that they're investing so much money in. And from that perspective, they would have a higher retention rate and don't have to worry so much about dropouts and constantly having to feed into that system. And it also creates a lot of bad reputation and dissatisfaction for those who ended up dropping out. And the schools aren't happy about that, of course. And I do think that not just in increasing the hours for the requirements, because at a certain point, I would be concerned that maybe teachers might be trying to fill the hour more than actual content, and that the quality of the content matters. I agree with the previous speaker that communication is a very important component. And I would add to it that not just communication with other physicians, which we do every so often, we also need to improve our communication with our patients as well, and other professions in the field. And that, like, for example, my friend went to a different acupuncturist because we don't live in the same part of the state anyway. And she didn't ask me or anything. She was like, oh, I'm just gonna go to an acupuncturist. I mean, you're good, so I assume everybody's good. And then she was like, oh yeah, so I have this problem. And they said, oh, this will be fixed within 2 visits. And she said, well, it was $100 out of pocket. I didn't go the insurance route. I got 20 minutes treatment, literally. That's it. 2 treatments later, I barely feel better. And she said, it's going to take a heck of a lot longer, blah, blah, blah. And to her, it was like I felt like I was kind of scammed, or that they weren't communicating what the process was like. And I think that I don't think I don't think ill of another acupuncturist who may not know that. I do think that it would be great if we can have a little bit more realistic expectations, and that is something we can teach in schools about what the prognosis may be. And so that we can set realistic expectations for patients, and that we ourselves know how to communicate well, so that we're not giving people a false hope. Like there are some patients where they come in and I tell them, look, from your MRI, you have some structural damage, the foraminal narrowing over there, all these different things. And I tell them, I don't know realistically how much of your pain is coming from that, because pain is so complex. Attend any medical lecture and you'll see that it could be their psyche. Psychologically, maybe they're really depressed and they can't say that they're depressed. So they emphasize on the pain because that's acceptable in their society. It could be other factors, lack of exercise, too much wrong exercise, all kinds of things feed into pain, and I get that. But I think it's important to be able to have a realistic conversation with the patient and say, hey, we're going to try to tease it apart and see how much acupuncture can help you with, but it's not a guarantee, because we cannot offer a medical guarantee to any patients. Even with the best surgeons in the world, they're not going to say, yeah, I guarantee you won't die on the table, because it's routine surgery. They say, no, look, have you seen our waiver? Yeah, you might die. Very low likelihood though. And I think being able to communicate with patients helps our reputation, because patients aren't saying, hey, I felt scammed. You said 2 visits and guess what? It's been several months. I keep coming once or twice a week. It has barely helped at all. And several months later, okay, fine, now I feel better, but I feel gypped at the same time. And they're unhappy. And that affects our entire profession. So, and that part of that can be learned in school, in that you can learn some basic terms that are on MRIs that are super common. Like a list of 30 to 50 would pretty much cover a good chunk of almost everything. And being able to tell the students, hey, this is what it means, and there's all these different levels of severity, and make sure that you just at least look over it. I'm not telling you to read the MRI imaging. I can't even read it. I literally go through orthopedic surgeons and other integrative medicine doctors who are MDs, who know how to read this, can see their charts and everything else. I have that kind of system set up for me with my patients. So I know what I'm doing a little bit. But I know a lot of people who don't even have that, and it is a very discredit to our profession. And I want us to be protected and to feel confident, and that you can feel confident even if you can't give a guarantee. That is literally the entire medical field, without a guarantee. So I'd love to see that. Anyway, that was my 2 cents. Thank you.
Thank you. Next, we're going to hear from Dita Garabagi. Hold on just a moment. We're sending you a request to unmute your microphone.
I would just also like to stress that the quality of the education matters a lot, not just the number of hours. I have seen the quality go down drastically in the last few years, and I would really, really like more scrutiny into that from the CAB as well as ACOM in the schooling system in acupuncture. Also, the communication skills is an issue, and not just with other providers of healthcare, but with patients as well, like Virginia just mentioned. That went in the direction of maybe scamming people, but there's also a lot of communication issues as far as asking the right questions, finding out the right information to be able to get the right diagnosis, and also communicate the treatment plan to the patient. Those things matter too. They matter a lot. And having the California licensure exam in various languages, and also having the education offered in different languages, I think is not beneficial to the patients and also not to the profession as a whole. Because if someone needs to have those alternative languages to study or to take a licensing exam, what does that say about their communication skills in general? Um, that means their communication skills with the English speaking population is limited. That's it. Thank you.
Thank you. And those are all of our requests for public comment via WebEx.
Thank you very much,
Oh,
David.
I take that back. Virginia, hold on just a moment, please.
I just have one second comment. It's also important to have bedside manners as I think part of the curriculum. I know that seems so stupid, but there are some acupuncturists who don't know how to communicate and like connect with patients. And there are patients where I've seen like they go on Yelp pages, thankfully not mine, hope to God it never is mine. But I've seen them say, oh my gosh, they were so rude. The way they kind of just pressed on you, they didn't even ask for permission or my consent to touch my body, different things. And I get it from as a Chinese American because I've been brought up and I have lived overseas in China. I know how they operate to some extent. And I know that the bedside manners over there is different for sure. But operating in America, people who are not familiar with this culture are shocked where they're like, you didn't ask my permission and you touch my body and you press all different places and you made me feel so uncomfortable. And it's you don't want a pending lawsuit with these things. And I think that just saying, hey, ask someone, especially if they have a history of PTSD, sexual abuse, and different things, just say, hey, is it okay if we do this? Can I drape you over at this area? Would you be comfortable? Can you bring down, I want to access this area of the sacrum for your pain over there at the SI joint. Would you be okay with bringing down the underwear to like around this level? Like different little things, but asking permission and being super respectful matters a lot in our profession. All right, that's my 2 cents.
Thank you. David.
And now we are finished with our WebEx
Thanks.
requests.
Thank you very much. So I think I want to open up for Member Liang. So what do you think? We got a lot of education. Looks like we ask for prerequisite scientific requirement or science requirements. There's a lot information brought in. I think we do need professionals to work with us on that.
This is Gregory Leong, general members. Okay, to protect the general public, there were people talking about raising the requirement from high school to a bachelor degree. I agree with it. I think for this noble profession, you should have a higher education. Thank you.
Thank you. Thank you. Well, I think there's a lot of information. I can only base on what I learn, what I know. But I think there's some of the information because of the board, the licensee board, for us, there's a Yinchun level. But I think there's a lot of information was brought in, more like subspecialized, there's a specialty for me to think, with a medicine. And the 4 years medical school, that's really the Yinchun level. Sure, the requirement go to the medical school, there's a lot of other, MCAT, there's a different exam. But I hear from the professionals also is concerning currently the students, right? A few years back, there's 8,000 students enrolled in. Currently, there's a decline numbers of the students. Absolutely protect the public. We need higher education and high standard, but there is a data driven, so I wanted to see the board want to be fair here. This is why the professional have to work with us on this, because really is, in China, there are those lineage training, which is a tutorial, from family to families, or their generation to generations. So I don't know. At this point, I know with the medicine, we go to the medical school, you graduate, have your title, and then you take the exam, step 1, step 2. I believe, we are in the Chinese medicine school, we have that too, basic science, and then we have a clinical comps exam too. But then we have the residency. See, this is where the part is more different, So I just want to put those in mind, because here the board is regulated the intern level. I understand we, want the higher education, but, how the gate approve, or the data approve, what's the level? 60 units right now is agreed on. With the tutorial program, I know the high school graduate. So there's a lot to think about it, and I would love to jump in bachelor degree, so, but would that work? Would that discouraged? So I don't know. And yeah, you can help us to work on.
Certainly, we can take a look. I think this is similar to the previous 2 items we were discussing, that this is incumbent on the profession and the educators in the industry to really come to an agreement on what standards they want to establish. Again, if the board comes in trying to bulldoze with the regulation, that regulation will fail because no one's agreeing on the standard. And so, like, if I've heard, 90 units suggested as a requirement. I've heard a bachelor's degree. Chairman Teki, you mentioned even like MCATs, and therefore you're going to have specific science requirements prior to entering into the field. Comments were provided earlier today of how other professions get a lot of their science requirements out of the way prior to starting their doctoral program, with acupuncture being one of the few that doesn't have it as a standard. So, and we've heard public comments where that may impinge upon the reputation of acupuncturists if they're not able to understand organic chemistry when it comes to pharmaceuticals. Not to say that people don't, but that's the background language. Or neuroscience, as President Philip Young was talking about for his specializations here. Is it happening so far into your post-secondary education, like at the master's level, that you're first being introduced to this? Every other healing arts profession has it introduced at the baccalaureate level. So I definitely see that standardizing the science requirements as a prerequisite may assist the field. But again, as mentioned earlier, with the degree naming and degree titles, there are people that this will affect. So that means that the schools would need to be on the similar page about this. That we would well understand the foreseeable outcome of people not being able to have that access to education or having to pay more for it. Being in alignment, I think that with other healing arts professions is not going to hurt the profession here, for sure. But we can continue looking at this, and just like the other 2 items, this isn't going to be solved today. The committee will definitely have recommendations for the full board tomorrow to continue discussing this, it seems like. But I think the committee's urging the profession to come to terms with some standards here. Thank you.
Thank you. We have an in-person profession.
Neil Miller from CalAtma. But that was a lively discussion on prerequisites in science stuff. We heard a lot about language problems, a few racist things, and some cultural sensitivity. That people put it out there and it was important to them, but I kind of summarized a little bit of what I was hearing and what I said before. I brought up, and it's been brought up, about sexual impropriety. And I think that this board and under Ben's leadership has done a great job. And you can look at the numbers that Jay presents, that those cases are going down. So we seem to be doing a little bit better about understanding and explaining, but from a board level, people are getting in trouble and talking about it, and we need to bring it back to the school level. And different schools, depending on if you're in one cultural differences. And I think that we need to bring all of that up to the same level for all Californians, that you need to understand the same level of sensitivity to patients. But there were a couple other things that were brought up that I think is important. Talking about gainful employment and the fact that that it's costing too much and those sorts of things that they put out there. So I try to figure out, how do I put that into the agenda item? Some kids get out of school and they're doing 6 figures in 2 or 3 years. And there are other kids who get out of school from the same school and they're not being successful. And I don't necessarily know that it has to do with the program, but maybe the individual. But it leads me to another thing in the same vein, which has to do with business, basic business understanding, basic business practices are not taught at a consistent level amongst all the different schools. And I think that that plays into why some people are more successful than others, because some schools do a much better job at teaching people how to be in business. So many of us for so long were all in private practice. So you need to figure out how to do those business things. More and more of us are getting jobs and working in hospitals, but you really have to understand how to do basic business rather than trying to dumb down the profession. So somebody talked about lowering the standards, that we're trying to get a more simplified education. Who wants to go see a more simplified doctor? If you want to get a simplified education, have less education because you can't afford to be successful, but you want to put needles in people, then you should be a technician. You should be an acupuncture technician, because you can't compare somebody who's going to get that many less hours. And we talked about improving. We were at 2,400 hours, and we talked about, we're only providing the minimal level of basic entry education. And that was the excuse for years when we were at 2,400, and now we hear the same thing at 3,000 hours. Just the basics, just the basics. Well, in California, expectations of the consumer are much higher. And I think that if you're going to talk about not the science requirements, but prerequisites, look at where we're falling short. We're falling short in business, making money, and some of these other areas. And I think rather than dumb down the programs, that we should make the program a little bit better. Look at where students are failing, where they're not getting the gainful employment, and figure it out rather than playing the blame game that it's somebody else.
Thank you. Anyone else in the audience like to make a comment? Thank you, Mr. Miller. Hey, we need you, so this is what you're here for. Thank you. Anyone else? As our EO, Mr. Bodia said, this is the items we really need professionals come forward, work together with the schools, because this is important. We totally agree, for patients protection, public protection, the standard, the prerequisite, this is the profession, the development for the last 50 years. And we can compare to the newer ones. There's nursing, physical therapy. There are those similar times, 40, 50 years of development. Compared to physicians, 150 years, that's a little bit different. But we really want to work together, make the steps. And I do want to keep this on the agenda to continue discuss as early professions or stakeholder has suggested. I think if there's no one wanted to add, Member Liang, if you have no question, I want to move forward. Yes? Okay. Anyone? No? Oh, please. Please stay on the agenda items. Yes. Thank you.
Hi, Julie Rose. I'm an LAC. I taught in the school that I graduated from for 7 years, I think, from like 1998 to 2005. And my school did not have, didn't require that people have a bachelor's. So there were many people, some in my class and some that I taught, that did not have degrees. And I saw some of the worst writing I have ever seen. It was mortifying. From American students who I thought, I don't know how I would ever know that this person had an inferior education, used their education inferiorly when I was being treated by that person, if I ever went to that person for treatment. It was incredible. I also stopped teaching because I was threatened by a student the night before I was handing in the grades, that if I didn't give him an A, he was going to hurt me. So that's when I stopped teaching. And I just think that having a bachelor's, having a minimal education requirement, or at least, let's say, attending community colleges where people get all their prerequisites to the point where they pass tests, maybe there should be a grade requirement as well. So you know that people know there's a standard for education in the sciences, and I'm not. I don't have a scientific mind, but my treatments are good. But I think that for most practitioners, they need to be able to speak the language. And if you don't have a college education and you weren't driven to have a college education, then there's a really good chance that you're not going to learn as well. You're not going to practice as well. So I just think a minimal bachelor's education, say a 90, a 93, is sensible for the safety of the public.
Thank you. Thank you. So since we opened up here in person, and David, do you have anyone online?
We certainly do.
Oh,
First-
thank you. Okay, thank you. I want to be fair. Okay, thank you. All right. Please.
We're going to ask everyone to raise their hands by tapping the hand button at the bottom of the screen. Dial-in users, dial *3. And our first request comes from Farshid Namen. Hold on just a moment. We're sending you a request to unmute your microphone.
Thank you. And also, I just want to remind the speakers, please stay on the agenda items. Now we discuss the prerequisite and the science of a requirement. Thank you.
Thank you, Dr. Dr. Mataki. So about this, I want to refer that the job description, which is happening in 2021, it is a very valuable document which you published, and I go through this once over and over. And through this, we can find very interesting things, which is very relevant. So what I understand from this document, according to the job description, job analysis, So that there was a huge interest for moving towards the integrative medicine. And I think that this is a policy which you are reflecting in the California CALE exam. So, and this is mentioned, what I marked it here, like 7 different parts of this 2021 job analysis. You're talking about the integration with the Western medicine. I think that the future, maybe not now, but I'm sure that in future, California Acupuncture Board should move from the esoteric medicine to integrative medicine. Not necessarily Dr. Mataki and I are medical school graduates, but you know, this is what our peer health providers asking us, patient asking us, and public acting expectation is that we treating them with the, with the common terminologies which is the using. So we have lots of things I see here in the job analysis which happened. And so, for example, 31% of the respondent asking for during this job analysis, they're asking for more clinical experiences in diverse practice setting, and which we have to consider that in the prerequisites. And also apart from that, one of the things which is very well happened in the USAN University when I serving in USAN University as a clinic dean is moving towards the electronic health record. I think this is helping our student to learn and communicating better with the other health professionals and also serving the communities and the public. So we have also need to goes toward this direction, that helping the schools and also the profession towards the more integrative, towards the providing them externship opportunities with the medical offices to work with the MDs, and also this is beneficial for the also profession and also Western medicine. And I'm sure that our students in the schools love it. Thank you so much.
Thank you. Next, we're going to hear from Virginia. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Thank you. I like what the previous speaker just said. It's very in line with what I wanted to share. The acupuncturists really need to learn business skills. There are a couple of factors, I think. One of them is learning from chiropractors, where we could try to see how they're doing their practice management and business skills, because chiropractors as a whole profession do make more money than acupuncturists, and we have about the same years of training anyway. But their business classes seem to be superior to ours, and they seem to be doing a lot better than we do. Another factor that we must consider is the actual cost of running a business, the math of it, whether you are an employee or as an actual private practice. Because I feel that a lot of people don't do the math. And because of that, they're shocked. They're like, oh, wait, so I have this amount of student loans, and as an employee, I get paid only 40K. But then after all the different stuff, I can't even afford to pay my student loans, and now I'm mad. That shouldn't be happening in our profession. And another thing would be, if you go into private practice, as do most chiropractors, they've learned how to be profitable. They've done the math. And I feel that at schools, what we learned was not sufficient. They weren't factoring in all the different things that you would be held accountable for, which is why a good chunk of acupuncturists, almost like 70% in my estimate, in my, not very scientific way, but like 70% of the profession after graduating with a degree in America end up not practicing past 5 years. And the number is even more when you look into the 10-year mark. And a good chunk of that, I would say, is attributed to the fact that they didn't do the math properly. And schools can help with that. And I think schools need to have that clarity to show them, look, this is how much it would really cost. And you need to find a job or create your own private practice where you can cover these costs. And having that clarity actually boosts the school's reputation, because they're like, hey, this isn't smoke and mirrors. We are absolutely transparent about the process, about the cost of schooling, about the cost of owning your own business. And we're truly here to help you succeed, rather than you being mad at us that you felt like you were underprepared. And it also helps with alumni donations, because when alumni do well, they have an absolute love for their schools, and they need to factor that in. Another factor is that it would be great if acupuncturists can agree on a base pay instead of playing limbo. Like, you remember when you were kids and you guys try
I'm
to see how
sorry.
low?
Yeah, this is a chair. I would like to stay on the prerequisite science requirement. I really appreciate all the business information, but I would like to stay on course.
Yeah, and I'd
Thank
say
you.
one more class would be the orthopedic testing, where you show the range of motion changes, which is super easy to do with acupuncture, and just show them how to use a goniometer and say, do a before and after. It helps insurance pay for you, and it helps you to feel more confident in your skills as well and be accepted by the wider medical community. And also the class also for business skills should include insurance, because most acupuncturists will take insurance, and they need to know how to take it and how they can decrease the risk of rejection, because otherwise a lot of them go broke and go bankrupt, and it's not fair. They really care about patients, and they deserve to succeed too. Thank you.
Thank you. David,
Those are all of our requests via WebEx.
perfect. Thank you. So,
Oh, I take it back. Next, we're going to call on GK. Hold on just a moment, please. We're sending you a request to unmute your microphone. All right, GK, we're going to send you another request to unmute your microphone. GK, this is David, the moderator. I'm going to ask that you type into chat if you wanted to make a comment or if that was an accident. All right, Madam Chair, I think
yes.
we're ready to move forward. I'll let you know if things change.
Thank you very much, David.
GK wants to make a comment but does not have audio.
Send it into the board.
We're going to ask GK to send that into the board via email. I'll send you an email in the chat. Thank you so much.
Thank you, David. Thank you, everyone, for this. I would say this another hard topic, but we do want to work together with the professionals, schools, and the licensees together on this. So, Member Liang, if you okay, I'm going to move forward. I look the next three items here: the clinical hours, the internship, externship. You know, I try to thinking if I can lump it together, but I don't think they all go together. So, but I do want to give the time limitation, and I like to stay on time. Would like to discuss these items, the clinical hours, the internship, and the externship. And I did went on to look at the Accreditation Commission for Acupuncture and Herb Medicine. Talk about the background, clinical observation, and a clinical internship and a clinical externship. Also, we have a member Liang stay with us for the last few months. And definitely, I want to go the same style. I want the public professionals come forward first. You know, let's just have the open dialogue and discussion on this to help this committee to help you work on this. So anyone have information, what was the request on the clinical hours for the internship and the externship? So Mr. Boudia, maybe you can help us.
Certainly. Thank you, Dr. Mateki. This item was at the request of one of our member schools. They were asking for the board to consider a different alternative. What you see in the materials is the board's current requirement of clinical education on the first page. And then on the second page included are what ACOM's requirements are, and that's what Dr. Mateki was referring to when she was introducing this. So what you'll note is that the board doesn't talk about internships or externships. That language is missing from our regulations. However, ACOM does have standards for internships and externships and the qualifications for both. I believe the The request was coming from Madam Huang from Five Branches to kind of open up the number of hours available for students at schools such that it exceeds, if you take a look at the regulation we have here, 1399.434, under subsection H, that first paragraph there. Let's go ahead and give a moment for the document to align so that we can have everybody from them. This is, yeah, you're on it. Bear with us, folks. Getting closer. There we go. Perfect. Thank you. So right there, H, the curriculum in clinical practice shall consist of at least 950 hours in clinical instruction, 75% of which shall be in a clinic owned and operated by the school, which includes direct patient contact where appropriate in the following, and then it breaks down further. But what you see here is the board requires that the clinical instruction happen, at least 75% of those 950 hours happens in a clinic owned and operated by the school. And the challenge presented by the school was that internships and externships aren't necessarily owned and operated by the school, but there's different requirements or requisites for that based on ACOM's requirement. So ultimately, perhaps Five Branches is on the line. I saw President Zeidman was on earlier. Perhaps Gina is on as well to provide a bit more detail on this. David, if we can check the WebEx platform. I'm not seeing them here.
Say that name again, please.
Either Ron Zeidman or Gina Huang. Of course, if there's any other schools that have been working with Gina on this that want to talk about this, they're welcome to.
I don't have either of those names.
Thank you. I had advised that the schools get together to discuss this, to provide the board sample language of what they would feel would be appropriate. One thing they might consider is that the board fall on ACOM's requirements here and perhaps just remove the 75% of which shall be owned in a clinic, owned and operated by the schools. But we really would like the schools, perhaps not, to be addressing this and bringing it to the board for the board to be able to look at.
So it's about the internship. So just talk about the language to the board.
Would you mind introducing yourself further, if you'd like, for the record?
Ivy, I present in California University, CUS. So about the internship here is like also definitely all the school in California we require for the night for our school CUSB we have 960 hours. So we also follow state, also follow ACOM's requirement. So we have a 3 phase. And the first phase, we just do observation. That's the first like item 1 here as 150 hours for our observation. And then the phase 2 is like a level combined together. So we have, we consider like a practice 2 levels as a phase 2. And phase 3 is like higher level. So pretty much how we divide the 960 hours in 3 phases. It's very simple and easy for our intern student to follow the first level for observation, and the phase 2 for diagnostic evaluation, start to work with the patient. Then they can start to practice in clinic. And then the last level, phase 3, is for them to enhance their more higher level working with patient for their academic learning, outcome, theory, and the clinic. And we have like consider phase 3 level 7. This is our school level for our clinic. So they, in case they can do their own practice in clinic under supervision, they can start to invoke their practice with the community. And then like we do our social community service to more public, like we call free clinic. So our student can reach more different patient, different people around the area. So they can able to meet more people and people will know about that. So start to build their own connection for the further future clinic practice after they get licensed. So level 7 is good for them. So they can do practice in the same location for the higher the practice that's called, so they can do the practice under the supervision. So this is about a little bit easier way introduce for the board member to know about our school operate. Thank you.
Mr. Hurd, go ahead.
Yeah, I'd like to just take a minute to do a clarifying comment. So the original idea was talking about with CAB's requirement of 75% is owned by the school that operates the clinic, and 25% can be done other places. So that has to do particularly with ownership. If you look at the ACOM requirements there, it has very little to do with ownership. It has to do with supervision. And what they define as internship is supervised by the school at any location. Externship would be that they'd go out and do community service with anybody that they choose. And if you look at it, internship hours are very allowed to be for most of the program. The externships are limited in terms of how much that they can do. So, the consideration, as Mr. Bodea had mentioned, was if ownership isn't really part of the requirement in most of the schools that are accredited, then the board's, it's like there's some reflection that the board's requirement of ownership is moot, or it's not part of the quality of what the education is. It really has to do with the level of supervision by the professionals at the school. That's just what I wanted to speak on.
Hi, Rob Hoffman again, Yosan University. I think Jay summarized it quite well. It's about the level of education and control, right, over the clinic environment. Level 1 interns, as was just mentioned, students that it's their first, however, 15 weeks or whatever in clinic, they do require a lot of supervision. And ACOM's hope and our hope in California and at the schools is that we can provide the level of supervision that they actually require at these early stages of their career. And how you would guarantee that if you open this up to an externship would require a tremendous amount of oversight, because that's what it requires at ACOM. Site visits, applications, memorandums of understanding. It's a huge lift. So I understand the desire to be able to offer more externships within the 950, but I'm just trying to figure out how you could manage that and assess it in a way that actually is beneficial to the students. Thank you.
Yeah, thank you for the update, and thank you, Mr. Hurd, for the background and also the explanation here. But I see here with how we call that, Accreditation Commission for Acupuncture and Herbal Medicine here. So it's aligned with clinical observation and a clinical internship, clinical externship. I hear the board also have the hours, how we want to set up. So at the beginning, the 75%, how this is worked, and also from, the professions I can hear, yes, who is qualified for the externship. So the school, if this is some board will work with, because if you contract outside of the school site, because I do know right now in the VA, there's a various program so student gain different experience. And also the internship, externship, especially the externship, a lot of opportunity. That's how students get to know or get to know outside. Or I think it's a little bit different because for most of the like engineer, computer, the internship is outside their school. So that's what I understand, provide the possibility for job opportunities. So I think there's a certain ways we look at that, maybe how to work with the schools on this, because it increase the possibility. Probably we all can see it when the students, when they goes outside their certain environment, actually they really being the advocates for this profession. I have seen it's very exciting from my experience with the faculty, work with the faculty for years in the hospital. Until you start to have a certain program, have the students coming in, they are like a butterfly. They fly all over the place, So physicians and different healthcare providers actually really welcome them because you see their excitement. So I think really board want how, we wanted to work on this to help. But also how to work with the school together. It is true, this is definitely is a partnership, but this in the future increase the opportunity for the student to gain the job because of the externship, right? And that will increase more students, want to sign up for the schools, want to learn. I do see there's a lot of interest, but you look, what can the students currently enroll? There's a lot of them actually had a firsthand acupuncture experience. And then they decide to learn this medicine, So I think that this is a very good, and thank you for educating me because I weren't sure. I just like, we have the hours, but then I look at, ACAHM actually laid out here is a very clear observation, internship, externship. Maybe this is the part we can work on together. We can help, who's qualified for the externship site, more reputable, the VA center. That's another part, right? So all the veterans VA center knows, have the acupuncture students there. That might be as a greater chance to provide more care for the members or for their members. So I'm just, wanted to echo on that. I think this is a very good on the agenda. So I like to keep this on it. Now I understand what this means. Because it is really important. You think about it, right? Students practicing the schools, but how many schools hired their own students after they graduate? I know that's great. Your school hired, probably you are one of the rare. But you hear my point, right? There's a lot of outside centers actually will get to know more students, so yes, please. We need you. This is why we have this discussion here.
So in a response to postgraduate training, Yosan University created a fellowship program. So practitioner or students who go out and get licensed through California Acupuncture Board can come back to our clinic and practice as professional practitioners. We pay them, they have the full use of desk staff, they have the herbal pharmacy at their disposal, and they have their supervisors in case they run, into problems as a new practitioner. So the program's been hugely successful. Our fellows are booked every single session that they're scheduled. And we put anywhere from 4 to 6 students a year probably through this program. So I would encourage any acupuncture school, to at least investigate into a program like this. I know that SEAM, Seattle Institute of East Asian Medicine, came down to visit Yosan about 1.5 years ago. They saw the program working. They instituted the same program in their clinic in Seattle, and it's also been hugely successful. So we're basically modeling a residency program. Thank you.
Very good. Thank you. Anyone else? No? So, okay.
Yeah, I think for this item, like we've we've put it out there. When this was suggested at the March meeting, there was a board member that seconded having this agendized as well. So we were creating this forum. Again, another item that we would like to continue hearing from the schools. And this one, again, another critical item that the schools should be on the same page about. We don't want to open it up to something that's not going to help the schools or the students ultimately. We want everybody to be in accordance with this. Thank you.
Very good. Thank you, Mr. Bodia. So you have.
I want to know if there's any reach out to the schools. We have 18, now 17 approved schools in California, and they're not here. So if any decisions come on here, like all the regulations that we've gone through in the last 3 years that are now law or regulations, their students aren't being informed about it. So this is a problem. I mean, everybody gets the notice, but I think that maybe a more firm notice of, hey, you guys are educating people and the acupuncture board is regulating you and you're not paying attention to the regulations. How well are you informing your students about the regulations if you don't even show up? And of those 18 schools, 80% of them have not shown up in the last 5 years. So nobody's talking about it, but I am. This is a big deal. And the schools need to be, I don't know, legally you can't hold them responsible, but sending a letter and letting them know that we've informed them and let them, their students know that their school's not paying attention to the rules and the regulations and doing a, how could they be doing a good job informing them? They're not going online and looking at the minutes and being able to decipher anything, and they're not giving us any input. So perhaps a summary of, you know, the acupuncture board is really reaching out to you. You have a responsibility to educate your students about rules and regulations, and you're not showing up. I don't know what we do about that, but we have to do something. If we have problems, and they have to take some responsibility for not addressing them.
Thank you. Did you?
They get the stick figure and the licensing notification. So it's like
I think it's an excellent suggestion. We can encourage participation. We invite participation. Forcing it, it's a bit different. But we definitely would love the schools to come. We've asked them to come, and happy that some showed up today. And hopefully that'll increase. I do recognize what Dr. Miller is saying. And we do now also include all licensees. So it's not just the interested stakeholders, but it's all licensees that receive notification of these board meetings. So we can look to perhaps include the schools as well, at least in terms of the notifications.
But, you know, thank you, Mr. Bodia. But I do want to see, because here we use the hours 75%. So how does it based? Who recommended that, right? So why not 50% or 30%? I don't know, you know. So this is where all those was based, you know, and also with the ACCI, ACAHM, currently is very clear as observation, internship, externship. I think maybe we can line together, and also, yeah, the 950 hours was very helpful. I did that too, but I think maybe we can align it together. But where does the 75% coming from? Why not 30% or 50%? So I'm just throwing it in. Maybe you guys know the history. I don't, but I think it's great. Schools start hire their own students, you know, 4 to 6 a year get hired inside the school, graduate. But if you graduate at 20 or 50 students, and I think for physicians, it's rarely we don't get placed after we finish the training. So this is why still, you know, very different. You know, same thing with the physical therapy nurse. That's where when nurse doing the internship and I believe or externship, however you want to call, that's how they got hired, and then also they find what they really passionate about it, different specialties. So I 100% agree. We need to keep this agenda. Also, I want when we update, let the president, madam, to decide, but from the committee, I think all those topic, I like to continue the discussion. We need the professionals, and also we do need the schools to help us. Yes. Finally hear my call. Thank you.
Yeah, Philip Yang from President of California University, Silicon Valley. I just share some experiences in our school management about the internship and externship. For the, we don't know, 75% is good or not, but for us, we have different considerations. First, in campus training, we have all the forms and also have the step-by-step supervision to the interns, and also have the systematic trainings for the interns for we teach spinal acupuncture, spinal diagnosis and the holographic needle techniques. They do need learn the techniques and the practice, including go to the free clinics events to practice, and also inside the clinical practice, so that they can grasp this technique proficiently. So the 75% is necessary, and in order to get more varieties of the teachings of the techniques from different the supervisors, so we do have different practitioners to supervise the teachings in our clinic. So that's our solutions. And then for externship, even 25%, we do encourage the students to have an externship from different practitioners. But we encountered problems. ACOM question us how you supervise the externship, how you can guarantee the quality of supervision, how you can guarantee the time, the puncture of the time, and how you can guarantee the real quality of the learning from our interns. So what's your tools for the assessment, and or do your school go to the clinic to do the supervision and to check out everything in their clinic? So, and then need the corresponding policies, forms, procedures, and so on. So we really cannot get this complete solution. Then we said, we quit this externship for these options. So right now we do the all internships. So that's my experience. Thank you.
Thank you. So maybe, yes, misheard, but I have one question here, right? So with the California 950 hours, so what's the hours of the clinical hours for the ACAHM or ACOM? What's the clinical hours for them?
I don't have that offhand. I'd have to do a little bit of research, but I know it's less than our hours that we require. And the other thing, the comment I was going to make is in our regulation there's no talk about externship or internship at all. Clinic ownership. Discussion about intern and externship is really a whole new topic. There's robust kind of work with the ACOM accreditation, which all our schools have to operate, right? So those are in play. We have more hours, opportunity for more externship hours because they could meet the ACOM requirement and still need a number of hours. And, so that's kind of a way to deal with that. So, and it just has to do with our hours, but this one speaks of ownership, not internship or externship.
Yeah, no, I think that makes sense. That's where, thank you, President Yang, for bring this up with, I have no doubt it, with the school internship, hands-on watch the students practice technique. But also that's where my question is like, because we do have the 960 hours. My question is where this 75% coming from? So at the time is, would this is a 50% would be enough to meet the ACA HM's standard, because of the hours, we have more hours to flow. Thank you.
Well, as Ben Bodea mentioned earlier, that the amount of hours, in terms of it has to do with ownership, not with like the supervision in terms of that stuff. And the origination of this probably goes back to 2005, where the board was still doing the institutional accreditation, was the only person on the, and there was some concern about ownership and what was going on with the money. It has nothing to do with this training requirement that we're talking about, right? So I think we can kind of look at it fresh, like what do students really need? And then the other part is realizing that we are married to the ACOM requirements based on our statute and law in terms of what they're dealing with. So I do think that there's not. The real initial question is that, and you'd mentioned it, Dr. Mateki, where it would give students more varied, real experience out in clinical training, and which you've seen has been very, very valuable for students, right? So, allowing for the schools to do complete supervision, but to be able to add other locations seems to be where the experience can be gained, right? There's not a big value in the ownership. It's really what's the quality of education and what's the level of supervision. And I think Philip Young was talking about that, and I think Robert Hoffman was mentioning that same thing as kind of student school representatives, right? So
yeah, thank you for that, Dave. Yes, Mr. Bodia. Okay, so I think we got enough information for this item, and we go ahead. We did open up for the WebEx, right? I believe so. Yeah, David, yeah. Do you have
Yes.
any? Yeah.
Yes, we have 3 right now.
Oh, okay. Now everybody waking up. Okay, thank you.
Farshid Naman, we're sending you a request to unmute your microphone. For everyone in the audience, we ask you to tap your hand if you wish to make a comment. Dial-in users, dial *3.
Thank you so much. So I want to continue what Dr. Neil Miller mentioned about the presence of the other school for being informed. I want to also extend that Council of Colleges, CCAHM, also is not available in most of the state meetings. So basically those which is try to help to develop, and being the sound of the acupuncture schools nationwide, are not presented in most of the state meetings, so they are not fully aware or engaged. And so one thing I want to explain about this part is that, which mentioned in one of the presentation of one of the speeches of the representative there. So is lack of the competencies. So in the Western medicine system integration. So ACOM mentioned very, very general about the interprofessional collaboration. But this is when we dig into this, basically, as a previous speaker mentioned, that basically the clinical competencies is not clear for all the schools. Basically, all the schools, if they have, externship site or not, which is not mentioned, mandated probably with the California Acupuncture Board, which I really love it because this is one of the lessons learned, which we learned from the 2021 job analysis. So that has to be there, and in the standards. I also want to mention that there is insufficient emphasis on the interprofessional collaboration and clinical competencies. So this is very important, and we need to mandate a specific national or California state clinical competencies for the acupuncture school. So Dr. Hoffman is there. He has a very bright mind. I think what he's doing in the USAN University, and also they define in USAN University the 42 clinical competencies, so for different level. And also Dr. Hoffman mentioned about the developed the the fellowship program. So for the graduate, recent grads, I think that California Acupuncture Board should publish some of these initiative as a best practice for all the acupuncture schools. So these kind of initiatives will fill the gap, which is very a strong gap. I think that it comes suffering from the clinical competencies for the clinical education. Thank you so much.
Thank you. Next, we're going to hear from Virginia. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Thank you. In response to the internship and externships, I think that for part of the school internships, there could be a recommendation, although not a rule per se, for group community, and that it should be established in every acupuncture school, only because so many acupuncturists have such a hard time finding reasonable pay. And if they can't do that, at the very least, if they've treated in a group community setting somewhat successfully, then they can, even if they charge $15 and they see 3 patients, they would at least make 45, and their salary would kind of come closer to like 90K. As a private practice person, even if it was community, they would still have a hard time paying all their expenses because it's, especially in California, super expensive. But at the very least, they could charge just people without having to go through insurance if that's not something that they're very well trained at. And then in terms of externships, I think 2 types of externships might be a really good recommendation. One of them would be acupuncturist, where they follow a successful acupuncturist that, I don't know, makes a certain income per se, and has some, has some ties to the school so that they can train under them briefly, even for just a semester, just to see what it's like to run a successful practice. And nothing beats like actual, in-person mentorship. And then the second part would be, and more importantly, training underneath a medical doctor, because we need to be in connection with the medical field, with the Western medicine, rather than being kind of our own island and we're always isolated. And having students go out straight into the world underneath a medical doctor means that medical doctors are now educated on what acupuncturists can do. They can see the results, and we don't have someone sticking it to their, showing them, hey, look, this is what happens with a stroke patient. This is what happens of Parkinson's disease. It can be just as easy as that. And when an acupuncturist is talking with a medical doctor, eating lunch with them, shadowing, it's a great opportunity for them to be a liaison for our entire field and elevate our field, because now they know what we're capable of. And it's like a free assistant, free labor. Just, we'll either keep our mouth shut or we will help out around a little bit. And then when we have time, we can chat with them during their, like those short little times, like in their breaks or lunch. And that allows us to, have that connection, and they might actually hire that acupuncturist and say, you know what, my office has like a small place. Why don't you come in like once or twice a week and I'll refer patients to you or something. And it allows them to have job security, which is one of the hardest challenges that we have in our profession. Thank you.
Thank you. Next, we're going to hear from Len Yang. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Hi, Lin Yang from AACMA. The clinical competency of the students and the clinical hours, it's not the only something that matters to the school. It matters to the whole profession and to the development of this type of medicine in US. And as we all know that the clinic requirements for current acupuncture students or previous acupuncture students are considerably low than the standard in China. My niece is attending going to the University of TCM of Chengdu University of TCM, and that's the bachelor's degree, and she's at her 5th year, and the whole 5th year is a practice year. So she's done the dietetic school training, and she spends whole year and to do the clinical training, and she does it from 8 to 5 the whole day, every day for a year, and she goes through all the departments of a hospital, so not just one department. So this level of clinical training, we can't even compete. So I'm thinking that since the China has abundant clinic, clinic resources, whether it's possible for our program to borrow their resources to send students over there, their hospital, a teaching hospital, and to do their internship there. So this is one. And in order for that to happen, we have to make some policy changes. Like 70% of the clinic hours should be done by the clinic owned by the school, and we have to change that. And I don't know if it's possible or plausible, but feasible. But I just threw this idea out there. And another thing I concur with two previous speakers. We can also seek the opportunities in the U.S. hospitals here and try to establish the integrative program, a training program for our students. And to be honest, there is no real sense of integrated medicine in any school, acupuncture schools right now. We call it integrative medicine, but we are not really doing it, okay? Because we don't have the opportunity and to offer this kind of program. We don't have the opportunity for the students to practice or to learning how to integrate Western medicine and Chinese medicine in the hospital setting, and this is the critical piece, an important piece for the students' education and the clinical training. So is it possible that the acupuncture board and the schools and the professions associations can work in together to create some programs and to seek out resources like this, and it will be really good for the students. Thank you so much.
Thank you. And next we're going to hear from Virginia again. Hold on just a moment, please. We're sending you a request to unmute your microphone. All right, let's try this again, Virginia. I'm sending you a second request to unmute your microphone.
Got it. Thank you so much. I just want to make a quick one-sec comment for, based on what Lin Yang said. I like her idea very much, and I think that it wouldn't be that hard to implement this. So, for example, like I've mentioned earlier, UCLA does have fellowships for 2 years, and of course, most acupuncturists aren't going to do 2 years. But UCLA and UCSF hospitals has the grand rounds, where it's online practically almost all the time, like 95% of the time. And it gives opportunities for, and it's not open to the public right now. I've asked for UCSF. It's open to only the people within their hospital and people who are affiliated. And when I tried to go in, they told me you're not supposed to be here as an acupuncturist. And I was like, dude, I'm interested in integrative medicine. It doesn't cost you any money. But it would be nice if the acupuncture board and acupuncture schools can actually reach out formally and say, look, let's do a formal collaboration. It doesn't cost you an extra penny. In fact, we can even have some of our acupuncturists present on certain topics that you guys are discussing and show what share a case study, for example, so that you guys can see what it can be capable of, and also we can learn from each other. It's integrative medicine isn't just acupuncture, it's also biofeedback and all these other modalities, and we need that communication for all of us to grow in this new world. And for the grand rounds at UCLA, I'm in it only because my professor is a director there, so I'm allowed to go in as often as I'd like. But if we can get schools and the board to somehow kind of reach out to create and establish these connections across the entire country at every hospital that has integrative medicine in any capacity, we can really grow our profession so much, and it doesn't cost us anything. Thank you.
Thank you. And those are all of our requests for WebEx. Wait, I take it back. Dr. So, hold on just a moment, please. We're sending you a request to unmute your microphone.
Hello?
Hello, go ahead, please.
Hello, I guess this is to address Dr. Mitaki's question about why is it 75%. I think 75% is necessary, mainly because you have to keep in mind that not everyone knows how to teach. I mean, all of us acupuncturists or licensed acupuncturists, we went through rigorous amount of training. However, you have to keep in mind, not everyone knows how to teach. And it's very important for acupuncture students to have good teachers who will guide through, who will supervise their student internship while they are treating the patient. So that's why I think it's important to have like at least 75% of their clinical, their observation and also their internship at the school, because the faculty and the supervisors at the schools, they are trained to be teachers, okay, versus externship while you are working with an acupuncturist outside or MD outside of your acupuncture school. They don't necessarily have the pedagogy. They don't have the educational, they don't have the training to be able to teach. Maybe that is a concern. Maybe they're lucky they will get someone who knows how to teach them, maybe not. So right now, I guess I think even 75% is not enough. Most schools in California, because coming from someone who actually visited many of the California acupuncture schools before I decided to go into my program. So right now in the master's program, so 950 hours. So most, when I went through the internship, I did, I think, OB, so observation, first phase, and the second phase, supervised practice, and then third phase was individual practice. And all three phases, 950 hours, I did it at my school's clinic. And this is very important, mainly because there's so much to learn, and it's like whenever if you do make a mistake or if you have a question, my supervisor was there to answer my question. And then later on, I went on into a DAOM program. That is when I was eligible to attend externship. During my DAOM program, we did like a integrative gynecology, integrated pediatric, integrated neurology. So I did that rotation. And then after that, we had specialty training. And during specialty training, that's when we had the option of doing our externship within our school clinic or externship if we found a MD or a DO outside our school who was willing to accept us. Most of my colleagues, my classmates, they did it at the school, but I was lucky enough to actually find MDs and DOs who let me work in their clinic, who let me observe in their clinic. But not everyone is that lucky. So that's why I really support the schools and also the board to try to work with the conventional medicine system, try to develop relationships and maybe have our acupuncture schools have collaborations with nearby universities, major universities, and have a program that has to be set, because it's very difficult for acupuncture, from what I'm seeing, it's very difficult for acupuncture schools to establish like strong relationship with other university hospitals. So we need help in that area. If we have that good connection, then the externship, like what Dr. Mataki was mentioning, how come it's not 30% or 50%? If we have a good relationship with outside of, if we have good relationship with other university hospitals, and students will have that opportunity to learn. But right now, it's very hard to establish that relationship. So that's why I'm in support that at least more than 75% of the hours should be done at our acupuncture school. And until then, I think, yeah, I think it's very good to start building collaborative relationships with other university hospitals in order for this externship to work. It's a good idea. It will bring our professions, our practitioners, the opportunity to have more job opportunities. So I do support that. Thank you.
Thank you.
And those are all of our requests for WebEx at this point.
Thank you very much, David. So let's close. Okay, very good. I just want to say it again, reiterate, thank you so much for the professions and the public for working with us. And, this is a lot of topic accumulated for years, and is a very good discussion. But also I know we do move to the, science world, data driven. I know, the 75% versus a 30%. And if it's Mr. Hurt and Mr. Bodia, if there is some kind of consensus, you can hear from the professions discuss about the internship, externship, and also the collaboration. They do like, goes outside, but the part is who's qualified to supervise, or maybe the board can work with the schools, ACAHM, to help them on this. Certain levels, so to create the future job opportunities as an externship, and go through the experience, they may get hired locally. So I like this discussion continue. But we do concluded the last two items, the prerequisite and then science requirement, and also now the clinical hours, internship, externship. So let's move on to the last two items. Those two is a very simple, member Liang. So I just want to open up and also questions and discussions. I would like to see the establish English proficiency requirement for foreign trained and the tutorial students not taking the Cali in English. I'm fully support. I think there has to some kind of minimal requirement for communication. I know maybe ACAHM have a certain rules and regulations. I don't want to discourage, the language issue, but I do want to have the minimal requirement. So I'm fully support on that, Ms. Member Liang, and I'm sure as your nursing background. So I just want to hear from you on this, but I am, fully support on this. You good? Okay, thank you. Mr. Bodia and Mr. Hurt, everyone.
Well, I can just talk briefly to it. ACOM's requirements for the TOEFL, and they require a number of other, they'll accept other kind of language testing besides that, but TOEFL is kind of the kind of recognized or the kind of standard that's used. Right now for their programs, they require a score of 61 on a TOEFL, which is a basic or intermediate understanding level. When they originally had come out with it, they had come out with more of a professional, like graduate level, which was actually 80 to 100% proficiency, right? So they dropped it down like that. And so it's with the board's program, the tutorial program, and the foreign trained applicants, they don't have to go through that. There's no ACOM requirement on that, so they're not being supported by any kind of language piece, and they're actually foreign and tutorial. They're more foreign students in there, so it does. For public safety, it does make some kind of sense, as you mentioned, Dr. Mateki, for some kind of requirement. And so that's just kind of a framework where we start from, right?
And the whole, the reason why this is on here is that this is a strategic plan item that the board had worked on last year and had affirmed based on stakeholder input with the occupational analysis and discussion that lasted all day. And so this is also just really an announcement, and as today has been, a call to the programs out there. But here, this is bringing the same requirement that is required of our training programs to these less regulated, in this specific context, areas to bring them in alignment. So that's all I have to say.
Thank you. Now let's open up to the public. Yes, please.
Philip from California University, Silicon Valley, just in the Bay Area, we have schools, ACOM accredited schools, and ACOM non-accredited schools. Then this creates a situation that's a kind of unfair competition. Like we have at least a couple of schools approved by BPPE and CEB. So their students can take the exam, license exam. So same right. And our ACOM accredited schools, you have to meet the requirement like the TOEFL 61 scores. And then the students say, oh, okay, I don't want to go to your school because I have another two options that don't need the TOEFL requirement. And after 5 years, they have to meet the ACOM requirement. But no, they have to get accredited. Otherwise, they cannot run the school. But within the 5 years, they're kind of more competitive in the enrollment. So that's the situation. And for the graduates, they do need the ability to communicate with patients. And this also, of course, affects the business. If you can communicate with the patients, more English speakers, you have more choice of the patients, so they can come over to you. If you cannot, you can only have limited patient resources. Also as a profession, if you don't have the very, very minimal language requirement, so that's kind of not meet or not go to the level of our profession. So I do encourage we have the minimal requirement. Thank you.
Thank you. Anyone else? No? Okay, let's move to the WebEx.
All right. So our first public comment will be from Virginia. Virginia, you should see a request to unmute yourself. Go ahead and select that.
Thank you. You guys might not like my comment, but I'm just going to say it anyway. I think that with AI changing the world quite a lot, in a few years' time, there's probably going to be a really great medical translator that's completely AI operated, that is also affordable enough for acupuncturists who speak foreign languages to be able to communicate well enough and safely enough with patients, and that there are amazing, competent acupuncturists that don't really speak good English, unfortunately, but it would be such a lovely boon to the field to have their expertise. And they just need to, like, it needs to be like a regulation or a law where for them to treat someone who speaks English, they must have that AI translator, and it must be certain standards. Perhaps is something we could consider probably down the line. I don't think there's a really great translator now, at least. I don't know. Thank you.
All right, and our next comment is from Sion Fain. And Sion Fain, you should see a request to unmute yourself.
Hi, can everybody hear me?
Yes.
Okay, great. So I actually work for ACCHS, a Bay Area school, who we have a lot of students here, and we have a Chinese program in the master program. And I do strongly push for the English competency. And because I agree with Virginia that AI is very much growing, and that translation down the line will be very helpful to our field, especially with English being the second language of a lot of practitioners who practice this medicine. But then also, I think that the words coming from your mouth speak strongly of your personality and of your it's a way to get closer to your patients. So like going through a translator creates a certain level of distancing psychologically for the patient to be less likely to share in, information that's a little more sensitive, maybe a little closer to their secrets or whatever we want to call that. It's a little closer to the truth that patients frequently with language barrier tend to be less likely to share. And then also there are a lot of social contexts involved with languages that just AI and translation just can't, like it's a level of interpretation that needs a lot more research, and probably in the next 10 years maybe can get a little more nuance of that, because personality is something that shows through language too. So I just want to say, and then also that I do see a lot of like when we talk about graduates getting business, I think language barrier becomes a major barrier in that respect. Much like the earlier speaker said, that students who graduate and do not have the English language speaking skills, even if they use a certain level of translation to communicate their ideas to the patient, they just like patients see that as an inconvenience, and as and to a certain level of distrust almost. Just the sheer level of language skills you don't have that just place you at a disadvantage. So for students who graduate from our program, I strongly encourage them to get that level of language skills, so that by communicating with your patients, you often get better patient retention, you get better patient rapport, you get, it's just tons of benefits coming from that. And then also definitely safety is the biggest concern of the board, right? So it's like the miscommunication frequently causes a lot more dangers that otherwise would not be an issue if there wasn't any kind of communication barriers. So thank you.
All right, this is a moderator, and I see no further requests for comment in WebEx.
Thank you. Okay, let's close the WebEx. You want to have anything?
Oh, no, we still have one more. Yeah. We can close that item, yeah.
Yes, I just want to add one other comment on this, because I'm sitting here listening, because acupuncture, we all know, definitely can be invasive procedure. But think about it, for physicians right now, if I go to a doctor, if I have to through a translator to do a procedure for me, so I just want to have some kind of idea myself here, so how the communication, so when we set a certain standard, one side we want for doctor degree, but another side we can't even communicate with it through an AI machine, to communicate. So I'm just sitting here, I'm learning, a lot of information to absorb, dissect, but I just, everyone put in your own shoes. If you're going for a surgical procedure through AI, you communicate with the providers, how this is going to work. Anyway, so let's conclude this item. So the last one actually on item is a necessity of graduation requirement to qualify for Cali. I know early there's a speaker here mentioning about there's a ACAHM credit schools or not credit license. So I'm a little bit confused. I think this is very important. for what's the requirement for Cali here. If you don't really have the ACA-HM accreditation process, then, we definitely have, the standard or requirement, but also is, how could you not have the graduation and then you can take the exam? So this is a little bit blurry, and I really want the board to work on that. It's absolutely necessity. We must have a standard to protect the public, because this is a new information brought to me, and so maybe it's addressed to some other program. Why is there's a ACA-HM not accredited program to get license? Please.
Thank you, Dr. Mateki. Ultimately, this isn't as necessarily connected to the ACOM candidate schools. This is more of a clarification for our programs. We've heard that there's some students, and this comes down to how the approval process for an acupuncture and training program is. It's a 3-part approval process. As I mentioned earlier today, it requires Bureau of Private Post-Secondary approval or regional accreditor, ACOM approval, and the CAB approval. CAB approves curriculum. Some students were thinking that if they've completed the curriculum, then they're eligible for the test. That's not how CAB sees it. CAB sees these as eligible training programs meeting all 3 of those requirements. So if that school is an approved school, you got to do whatever that school's been approved to do. So if there's an exit exam, or if there's like some electives that you haven't taken, if we don't see that you've graduated on your transcript, you're not qualified to take the licensing exam. So it's a simple statement really to just affirm the board's regulations.
I can attest that we're not approving anybody to take the CAL without a graduation. It's required on their transcripts when they submit them. And as Ben mentioned, they all have to have a ACOM accreditation as well, right? So there is some gossip about what's going on, but I think it was hitting at what Ben was doing. It was that when they've completed and graduated a program, the school may have an exit exam, and they may choose to waive that. We don't have a requirement that they do the exit exam, but we do have a requirement that they graduate, right? So if the school let them go without going the exit exam, we wouldn't see that, right? But they would have to graduate, and they would have to complete the approved curriculum.
But would you submit your graduation diploma?
On the transcript, they say date of graduation right on the transcript that they have to submit to us, and it's a sealed envelope directly from the school.
Okay.
Yeah, and everybody presents that. You can't qualify without transcripts.
Perfect. So really appreciate the education and update. Shall we open it to the public and stakeholders in person? No? Okay, let's open up to WebEx.
Thank you, Madam President. If any member of the public would like to comment on this agenda item, please raise your hand. For members of the public who have called in, you may raise your hand by pressing *3. We'll give you a moment. And I see we do have a raised hand from Lynn Yang. Lynn, you should see a request to unmute yourself.
Hi, Lin Yang from AACMA. I just wonder, I understand that for students on a acupuncture program, they needed to graduate in order to sit for KO. But what about the tutorial program? Is there a requirement for them to meet the graduated requirements? In order to sit for the KO, I'm not clear on that part.
As a point of clarification, tutorial programs aren't in a training program. They take some of their courses at the university level, which are required, but those are usually can be completed at community colleges, state colleges, private colleges, UCs. So like there's a wide area that they can get that. Now there's some acupuncture education that they could take in lieu of receiving that education from their supervisor or in addition to. So that some schools allow for those students to take those classes there, but there is no graduation because they're not graduating from anything. They have to complete the tutorial program, which has specific requirements, more hours. So they're different breeds there.
Okay, so as long as they meet the requirements for tutorial program, and they can sit for KO, but they are actually don't have any degrees and things like that, correct?
Correct. It's akin to an apprenticeship program.
Okay. I just wonder about that. Thank you so much.
All right. This is a moderator, and I see no further requests for comment from WebEx.
Thank you very much. And I think this is any question? Oh, yes. Now we move on to the agenda item 7 for future agenda items. So let's start with Member Liang. Future agenda items, what would you like to see to be on?
So Gregory Liang, public members. And for future items, I would like to see that we have sent out a survey to all stakeholders regarding the definition of acupuncture and possibly the doctor title, whether it's DAIM or DACIM or DACH or DAIM, and let's get a feeling from the stakeholders on what they want to have. That's all I have. Thank you.
Madam President, Madam Chair, before we go on, I just want to remind our public members of the public for these items. We have already discussed that we are going to be bringing a number of these items back. So this would be any additional items that we haven't discussed today that hasn't been agendized that you would like to see at a future licensing committee meeting, not a board meeting, a licensing committee meeting. Thank you.
Thank you. Thank you for the clarification. Thank you, Member Liang. Anyone else?
Yep. Neil Miller from ATMA. I don't need 5 minutes. Thank you. I would like to see the education committee understand a little bit of what went on in the past. Like I brought up Little Hoover Commission. I don't know if Mr. Leong or any other public members, or even the board members, even know what it is. I've talked about it. So I would love to see the board members being given a copy of that and then talk about what did the Little Hoover Commission say and where are we at now in terms of our education and education committee to have a discussion on what did they say, what's still, I mean, I bring it up, but let's just take a look at it. Let some of the new members, the public members, take a look at it and bring it up because they gave the profession and the boards very specific things that needed to be changed and it hasn't been done. So rather than me coming up here and talking about it again and again and again, I'd like to see it on the agenda that we at least discuss it and maybe identify some of the things that are in there, and then maybe we can pick off some low-hanging fruit, and we could continue to go with the vein of this board, which is understanding what went on in the past and moving forward. And thank you again for a really good agenda and a good meeting today.
Thank you. Anyone else? No? So I really want to thank the staff. Oh, let's open up to the WebEx.
Thank you so much. We do have a raised hand. So, and just a reminder for anyone logged into WebEx, if you'd like to comment, please raise your hand. Calling users can raise their hand by pressing *3. And we have a raised hand already from Lean Yang. Lean, you should be able to unmute yourself.
Hi, Leon again from AACNA. I'd like to the board to put the consumer brochure on the agenda again to discuss the more details on the brochure. So we I think that we as a CIC we missed the opportunity to make a contribution or to that consumer brochure, and I do want us to discuss the inclusion of the conditions that are being removed, because as from this the patient perspective, if I have like a lower back pain, I wanted to know whether acupuncture can help me. If listed that it will, or the study shows it helps, then I probably wanted to go to give a try. If I don't find anything like that, I wouldn't want to give a try because I don't know. And not every consumer or a patient is savvy enough to search online and to do a lot of reading or researching or research. So, so I would like to have the opportunity to discuss the consumer brochures further. Thank you so much.
All right, and we have a request for comment from GK. GK, you should be able to unmute. GK, did you have a comment to make or? All right, so I will go to the next person, which is, oh, Ling Yin, your hand is up. Did you have a further comment? Okay, she lowered her hand. All right, I'm seeing no further raised hands, no further comments from WebEx.
Thank you. Let's close. Okay. I just want to reiterate. First, I want to thank our host for help us host this beautiful location and a very friendly environment, very comfortable. Thanks to President Philip Young, for your hospitality. And also I want to especially thanks the professionals who join us, and some of you driving from LA coming over here. Really, really appreciate your support to participate to the board meeting. We could not do this without you. And especially want to thanks to Mr. Baudia and your staff. Everyone's here, our tech support and the DCA support. And our legal, and thank you. And your chair always gets you in trouble, and I try not to do. And I'm really grateful for Member Liang, who brought the wealth, the knowledge, and experience in the healthcare. It is really a pleasure to work with you, and thank you very much. It is 4:58. I promise I finish before 5. Meeting adjourned.